All right. Hey, everyone. Thank you. I think we're having folks load into the webinar right now. Evan Harris here. I'm Media Relations and Outreach Manager with PRI. And today's webinar, it's going to be great and very timely. It's going to be about Medicare for All and the COVID-19 crisis. So we are honored to have PRI's President and CEO and Thomas W. Smith Fellow in Healthcare, Sally Pipes. Sally, thank you for being here.
Thank you, Evan, and thank you everyone who has come on and is willing to listen to this very important subject today.
All right, well, let's get right into it. First off, polling. We run a monthly poll, the Single Payer Poll Watch, and we saw this last month, a huge jump. It was almost 10 points in support for Medicare for All. Why do you think the increase in support happened so quickly and drastically?
Well, I think one of the reasons is that Senator Bernie Sanders, who of course has dropped out of the presidential race, but is a big player in the single payer debate, he has continued to push. I just saw the other day that he and AOC and Pramila Jayapal from Washington State have joined the Biden task force. And so Senator Sanders has been pushing this since 2016 in a big way. The American people are now kind of thinking, well, you know, healthcare will be free. I won't have any premiums, any copays, any deductibles. And then with COVID-19, I think a lot of people, were worried about losing their jobs if they had employer-sponsored coverage, or they have lost their jobs. So, this sounded like a very good idea. The polling, as you mentioned, it was up to Kaiser showed 56% support for Medicare for All in April, up from 54% in June of 2019. The Hill Harris X poll showed support at 69%, which was the number in April, which was an amazing jump. I think what we have to look at is most people don't understand, Evan, what Medicare for All is. Medicare for All or single payer means there would be no private coverage in this country for anything considered medically necessary. All insurance companies would be out of business. And I think, people don't really realize that. They don't understand what Medicare for All is. So in the Kaiser poll, when they asked people, well, so 55% of you support Medicare for All, what do you think about it if it means that you would lose your employer-sponsored coverage? And that support went down to 37%. Because a lot of these people thought they could keep their employer-sponsored coverage. This would be for other people. And the other question that was asked is, well, how do you feel about it if you would have to pay significant tax increases? And on that note, support went down to 26%. So as we know, the tax increases for Medicare for All, and we can get into this later, would have to be very significant. With the COVID, I think it's very important that we look at countries that have single payer or universal coverage systems, which are almost single payer. If you look at the UK, you look at Canada, you look at Italy. I was looking at the numbers for the deaths from the the coronavirus and comparing it to and putting it on a per capita basis. If you look at the UK and Italy on a per capita basis, their deaths are over 2 times. They would be over 2 times what they are in the United States. People don't realize that there was a 9-hour lineup for ambulances in London trying to get into one of the NHS hospitals. Because if you look at intensive care unit beds in the UK, there are only 7 intensive care unit beds per 100,000 people. In Italy, the number is 12, but in the United States, it's almost 35. So we have a lot more capacity and a lot more access to good health care. So polling is interesting, but I think people don't understand what it is. And when they do, they're just not going to be as favorable to it.
Yeah. On the polling note, and you mentioned it with Kaiser, a lot of people like the terminology, but when they find out what it actually does, they're not as supportive. How do we better educate people about the reality of Medicare for All?
Well, I mean, one of the things that, I write a weekly column for Fox News, and many of the columns of the options that I give Fox, my editors there, they choose so many of the options that they choose are ones related to Medicare for all, ones related to the pandemic, ones related to what does Joe Biden, if the presumptive Democratic candidate, what is his healthcare plan? So that is one way. And I also, as you know, write biweekly columns for Forbes and for the Washington Examiner. But debates, interviews, and in particular, I think it's very important that we get our message out to the middle of the road people who don't spend a lot of time thinking about these issues on a higher plane. We have to educate them through, and talk radio, as you know, is a great way to reach these audiences. As you know, I do a lot of talk radio, and I've sort of become a regular on the Larry Elder Show. He always plays that Mustang Sally song before I come on, which is always embarrassing. But, I think this is, giving a speech is one thing, but, you may reach 100 people or 200 people in a speech. We've got to reach wide audiences. And of course, using the webinar and the Zoom in this environment is very helpful. Yeah.
One more note. So middle ground, we're trying to get folks in the middle. What's with, physicians seem like they're more supportive of Medicare for all now. What is with that switch? Wouldn't a single payer system be disastrous for medical professionals?
Well, absolutely. And of course, under Senator Sanders' plan, that any of these Medicare for all single payer plans, in order to make them even work, not counting the long waits, the ration care, higher taxes, doctors would have to be paid Medicare rates, which are about 40% below what they're paid today. So many docs, we know, will quit medicine. Many doctors quit practicing medicine when Obamacare came into being. The American Association of Medical Colleges has predicted by 2032, there will be a shortage of 122,000 docs. And that's before they didn't even ask the question about Medicare for all. But the polling among the docs, the American Medical Association, most people think that all doctors are members of the American Medical Association, the AMA. In fact, only about 18% of doctors in this country are members of the AMA. At their annual meeting last June in Chicago, they had the highest rate of support for Medicare for all at 47%. 53% were against it. But I think what we've seen is that Physicians for National Health Insurance, I debated their president at Intelligence Squared last September, but they've been really aggressive. They set up a chapter called Students for National Health Insurance. And of course, medical students in the medical schools, most of their education is from doctors who support Medicare for all. So to me, it's not surprising that the support has gone up because it's so much in the limelight. I think too, that a number of docs in specialized associations they've moved away from the AMA and the whole idea of Medicare for all and into their specialized, whether it's the Orthopedic Association, the Ophthalmologist Association. And in those groups, the support for M4A specialist groups is a lot lower. And I think, with primary care, we're seeing a lot of support because of the reasons I've mentioned.
Yeah, good. Sally, you've written a lot about if the U.S. had a single payer system in place when the coronavirus hit 2 months ago, it really would have complicated efforts. Why would Medicare for all have been a disaster with the COVID-19 crisis, and why is it not the answer for any future pandemic?
Well, I mean, I think, as in the beginning, when the numbers started to rise, it was the federal government that caused a lot of the slowdown in stopping this. The CDC, their COVID testing, many of those tests turned out to be contaminated, and the CDC would not allow private companies tests to be approved and to be used. And so that was a disaster. It's another example of government, screwing things up, really. And so we just, as mentioned earlier, the UK, long waits for ambulances to get in, very few ICU beds. And, with Bernie Sanders' plan or Pramila Jayapal's plans, I mean, the cost of these single payer programs would not only be a financial disaster, but it would be a disaster for the American people and the kind of healthcare that they've come to expect.
Yeah, I mean, let's look at other countries. You've mentioned a little bit about Canada, the UK, and Italy. what generally can they tell us about single payer healthcare historically, and then we can talk about how they fared under coronavirus too.
Well, in Canada, which is the country where I'm from, and I grew up under single payer, we started at the Fraser Institute, where I worked, a program back in the late 80s. And the first study came out in 93 called Waiting Your Turn, A Guide to Waiting Lists, because the government in Canada fully took over the healthcare system back in 1984. It had been edging at each of the provinces before that. But by 1993, the average wait in Canada from seeing a primary care doc to getting treatment by a specialist was 9.3 weeks, i.e. just over 2 months. Last year in 2019, that average wait had increased to almost 21 weeks, 5 months. Do you think the American people, my mom used to say, you're becoming one of those impatient Americans. Americans are impatient, and are they going to sit around waiting for 5 months to see a specialist? The average wait for getting an appointment with a neurologist, neurosurgeon, is 33 weeks. So not only are the waits long, it's not free. Senator Sanders gets up on the podium, he says, the average American family spends $11,000 a year in their healthcare premiums. My plan, there'd be no deductibles, no premiums, no referrals, all of these things. Well, he should look into the numbers, because in Canada, the average family of 4 pays taxes of $13,311. Those are in hidden taxes. But in order to get on a list where more than 1 million Canadians are on a waiting list trying to get a doctor for a regular, what we call a general practitioner, this is not something that the American people nor we should support. And the other thing is that Canadians do have an escape valve. 323,000 Canadians out of a population of about 35 million crossed the border and came into the United States and paid out of pocket for MRIs, shoulder surgeries, heart stents, things like that, because they felt that the waiting time was too long in the interest of their long-term health. And if you look at the United Kingdom, in late 2019, the NHS is turning 72 this year. It's 90% of Brits belong to the National Health Service. At the end of last year, 4.4 million out of a population of 60 million were waiting to get into a hospital and have their treatment. They couldn't achieve their 62-day target for getting cancer treatments, and they were at the bottom of the list in international tables for cancer, 5-year cancer survival rates. So, these numbers, I think it's one of the reporters in The Guardian had a great statement, The Guardian being the British newspaper. He said, the NHS is the world's very best healthcare system. Its only black mark is its poor record of keeping people alive. And I think this is something that, the American people need to realize. M4A, single payer, long waits, ration care, higher taxes, doctor shortage, all of these things are, whether you're in Italy or in France or in the UK or in Canada, these are the results of when government can set the budget of what is spent on healthcare.
And how have these countries done under coronavirus? I mean, theoretically, they should have an advantage over a country like the U.S., but I don't think it's right.
No, absolutely. As I mentioned, if you on a per capita basis, if you took Italy and the UK, for example, there would have been 10 times as many deaths as they're pointing out in the UK and in Italy. The Canadian, the head of the Canadian Medical Association came out and said, we are not prepared in Canada for the coronavirus, this pandemic. We don't have the capacity. And, they should have looked back, because it was in 2002, 2003, when the first SARS pandemic hit. And it really hit hard in Ontario and in Quebec, which is where the COVID pandemic is hit. In 2002, 2003, there were 375 cases of SARS in Canada. Of those, 44 people died. In the US, there were only 22 cases and no one died. And, so if Canada's healthcare system hadn't been so fraught with deficits in the healthcare system, they should have been prepared for this pandemic. One chap in Ontario waited over 16 hours in an emergency room to get a bed in a ward. And as his brother said, you know, he was spreading the SARS virus around the ER because there were no beds. And we're seeing, as I say, the ICU beds per 100,000 in the UK and Italy and Canada are very low compared to this country. We know with COVID, even in San Francisco, there were so few cases that a lot of the top docs at UCSF flew to New York to help with the situation there, because New York is a large city, a dense population, and the COVID, you know, was very rampant. We also know now that a lot, you know, the majority, the high percentage of deaths from COVID have been among the elderly, and in particular with those people in nursing homes or those people with pre-existing, in particular, respiratory ailments.
And speaking of that, coronavirus, obviously, there's been a lot of respiratory and heart ailments. You know, patients need to see specialists for this stuff. You've talked a lot about specialist wait times in places like Canada and the UK. Can you talk about that a little more and explain what the US would see if we had similar models?
Right. So, you know, Bernie Sanders is always saying, you know, in my healthcare system, there would be no referrals. Well, you know, as Charles Blehaus at Mercatus, and of course, the Urban Institute, both opposite politically on the spectrum, both of them have pointed out that the increase in federal spending under a single payer system would be between 30 to 40 trillion dollars over 10 years, bringing the total cost of healthcare up to about 60 trillion dollars over 10 years. Government would have to set a global budget, just like they do in Canada. Canada will only spend and can only afford to spend 11% of its gross domestic product on healthcare. We spend a lot, more than any other country, about 18%, but Americans really want the best. And so, you know, this idea of no referrals, it just wouldn't be able to happen, because everybody would be ringing up their ophthalmologist or their OBGYN, and there wouldn't be enough doctors. And so it would be a catastrophe.
Yeah, let's stick with the cost. I mean, you always hear we need Medicare for all from the advocates. How would they pay for it, especially now? The federal government, state budgets, we just saw the deficit. I mean, how are they going to pay for this with the looming recession or worse?
Well, exactly. As Amy Finkelstein, a very noted economist at MIT, said, even those numbers of 30 to 40 trillion over 10 years are low, because when people think something is free, they're going to use a lot more of it. So those numbers are probably even low. But, you know, Senator Sanders, I mean, his plan, he's saying there would be a new 4% personal income tax on anyone earning over $29,000, a new 7.5% payroll tax, taxes on the wealthy, taxes on large financial institutions. And so, you know, and then combined with cutting the payments to doctors by 40%, this is just going to be catastrophic. So, and as Charles Blehaus said, if we doubled all of the personal income taxes and all of the corporate income taxes, it wouldn't be enough to pay for a single payer. The other issue is we talked about doctors quitting medicine. In Canada, doctors are their own employer-employee. They work for themselves. The problem is there's only one person that pays them, and that is the provincial government. My niece, who graduated 5 years ago as an orthopedic surgeon from the University of Manitoba, Megan, and not one of her friends was able to get a job as an orthopod within 3 years. And yet the waiting times for orthopedic surgery in Canada are the longest of any, but it's because the provincial governments can't afford to pay that. But if you look at salaries, the average primary care doc in Canada makes $146,000 a year. In the US, that number is $218,000. In the UK, it's $134,000. We want to be able in this country, as we always have, to attract the very best and the brightest young people into our medical schools. If the government were to take it over and we had single payer, I can tell you right now, the best and brightest kids are not going to go into medicine and become the best doctors and the best specialists.
Yeah. Well, on that note, so Joe Biden has become the champion of the public option. You've written a lot that the public option is just the stepping stone to Medicare for all. Why is that the case, and what is so bad about, a lot of people like the public option because they think it's in the middle, but what's the reality behind that?
Right. And so the Kaiser Family Foundation poll, which I like to quote because they're considered sort of, a very balanced poll, they show that 68% of people that they polled support the public option versus that 55% supporting Medicare for all. The public option was originally in the House version of the Affordable Care Act. The public option being a government insurance plan that would compete in the exchanges against private insurers. It didn't make it through because the Senate felt that they would never be able to get the bill passed if it had a government plan. So Joe Biden, the presumptive Democratic nominee, who said, only 85,000 people in America have lost their jobs and millions have died from COVID. I mean,
yeah.
he wants to build on Obamacare, which today only covers about 8 million Americans on the exchanges. And about 87% of those people are people who qualify for that subsidy up to 400% of the federal poverty level. So he wants to build on Obamacare, and he wants to insert that public option. I think it's interesting that Colorado, Governor Polis, who's a Democrat, signed the public option legislation there. And just last week, he said, we cannot afford this to have a government insurance plan, so we're going to put it on hold. But meanwhile, Joe Biden is pushing it. And what would happen, the reason I call it a stepping stone approach is because if there's a government insurance plan competing against private insurers, we know the government will price their product cheaper than the private sector can afford to offer their coverage. And so they will ultimately crowd out private insurers, and over 1 million people who work in private insurance in this country will be out of a job. And as Bernie Sanders said, well, we'll hire a lot of these people to become public servants. Well, how can you be sure they would want to become public servants? And what is the cost going to be to expand HHS or whatever the department within government is? Because it would be absolutely huge. But really, public option is a stepping stone approach. Probably it would take about 3 years. I mean, we know Elizabeth Warren, when she was in the race, she sort of stepped back her single payer and had a 3-year moving program to single payer by using the public option. But people need to realize it is a stepping stone approach to crowding out all private coverage. And in the Kaiser poll, we talked about how, when you ask people about what if they lost their private insurance, 71% of people polled said that they rate their employer-sponsored insurance as good or as excellent. So, I think this is something, a really major education program for the American people to let them know what this all means for them and their health.
Another area, moving over to innovation, innovation would probably be hit hard by Medicare for all. It feels like Genentech and Gilead with the coronavirus very early, very quickly were in clinical trials for some type of treatment, potentially a vaccine. We'll wait and see. How would that be impacted under a Medicare for all system?
Well, when you look at it, there are about 100 companies that are doing research into the vaccine. I mean, there is the Oxford group in the UK, but a lot of that funding has now come from AstraZeneca, which does its research and development in this country. So Gilead with its remdesivir, I mean, they got that, right up, and the FDA gave it a fast track approval, which was terrific. But, we need to keep the pipeline open for new treatments and new drugs. Many of these treatments that we consider, life-saving cancer, biologics, biosimilars, these expensive drugs aren't even available in countries that have price controls like Canada. It takes about 2.3 billion from a drug or biologic from an idea to getting it through all the trials, through the FDA. And so $2.3 billion, only 1 in 12 of the drugs that actually go through the process actually are approved. So we need to keep this pipeline open, because when you look at the big companies, whether it's a British company, GlaxoSmithKline, Roche from France, GSK from the UK, They all do their R&D in the United States, and that's because we don't have price controls. And these other countries are free riding off our R&D, which is, you know, a disaster, and it's not fair.
Yeah. Well, speaking of disasters, for our last question, Sally, you recently published a book, False Premise, False Promise, The Disastrous Reality of Medicare for All. You documented, you know, many failings of single-payer systems. Can you go through some of the more compelling case studies or mention any interesting tidbits folks would find useful from the book?
I think that's one of the reasons that Nick Gillespie and I won the Intelligence Squared debate and converted so many people in New York last September was, as many people said, because I told stories. And I think, you know, for the man on the street talking about 18%, $30 trillion over 10 years doesn't relate to their lives. But
Yep.
if you look at the stories from Canada and the UK, take a look at Michael Bublé, the singer, the crooner from Vancouver, whose Christmas album CD I play nonstop starting at Thanksgiving. I mean, Michael Bublé, who lives in Vancouver, very proud Canadian. His son Noah, at age 3, in Vancouver, was diagnosed with liver cancer. The Bublés did not stick around waiting for the BC Cancer Agency to see, you know, how would he be treated, when would he be treated. They immediately went to Los Angeles to the Children's Hospital of LA, had his treatments. As Bublé said, they had the very best doctors. And 3 years later, their young son, Noah, who's now 6, is cancer-free. This is what I talked about. Canadians have an escape valve. My own mother died from colon cancer because as a senior, she was told there were too many young people waiting for colonoscopies, even though she had conditions. And so she sadly didn't get a colonoscopy and passed away 2 weeks later when she finally got a colonoscopy. If you look in the UK at the Rolling Stones frontman, I love to talk about Mick Jagger because here he is, he's back, he's gyrating around on the stage in places where he can during the pandemic. But you know, last year when he was diagnosed with a heart valve problem, and you know, he's a Brit, he did not go back to London and go into the National Health Service. He immediately went to New York Presbyterian Hospital in New York, had his surgery there, and survived and recuperated very, very quickly. His younger brother, Chris Jagger, said to the media when Mick was recovering, "Thank goodness Mick has not got to wait in line for the National Health Service." So, you know, these are stories. My book is full of these kinds of stories. Sharon Stemblau in Ontario, who had leukemia, but the Canadian hospital system couldn't deal with her. She had 3 young children. So these are all stories when government decides who's going to get the care, what kind of care we're going to get. It's a disaster.
Yeah. Well, that's it. It was very informative 30 minutes. I hope everyone listened and took notes. And if you were slow or didn't, I would invite you to go to pacificresearch.org. You can find a link to Sally's book, all the great stuff she's written, as well as all of our other research. We'll be back on June 11th with another webinar. And Sally, I wanted to give you the last word before we sign off.
Well, as my great friend PJ O'Rourke says, if the American people think healthcare is expensive now, just wait until it's free. Thank you.
All right. Thank you, everybody. And thank you, Sally, for joining us.
Thanks, Evan, for hosting this.
Yeah. Take care.
Bye.